So, very good evening, ladies and gentlemen. My name is Vichu and I represent Sanifos here. And this webinar is basically SFA software transformation in the OTC sales and distribution partnership with SalesJump. That is what this particular webinar is all about. With us, we have Mr. Saravanan here, who represents SalesJump, who's a market expert. And my name is Vichu, and I'm the BDM for the Sanifos. And this webinar is completely gonna be an OTC as well as distribution platform when it comes to the pharmaceuticals, healthcare industries, and also into the FMCG industries. The challenges that has been faced by the distributor order management or the primary orders that has been taken by the companies, how to manage the orders and the challenges that the executives are facing in the market, and how as an organization, as an SFA vendor, how we are going to give you a solution to overcome the challenges on the daily basis. So we have certain agendas and the areas that we personally believe which has to be done in the seminar, which has to be highlighted in the seminar. That's what this is going to be all about. So Saravanan here, who's a market expert in this particular product, will be walking us through the seminar completely. So handing over to Mr. Saravanan from SalesJump. Yeah.
Thank you, Vichu. Thank you so much for that. And thank you everyone for joining. And thank you, Mr. Sanjay, for organizing this and making it happen together. And so as we discussed, so the order booking and order management was the key feature which all the pharma OTC sales and distributors were actually required. So based on our research in the market, the many OTC companies, they are using a multiple tools for the SFAs, the Salesforce automation, especially in OTC. Many companies, they are using a separate order booking management, and also they are using a separate tracking and reporting application, and they are using a Visualite separately. So these challenges are leading in for a insufficient or ineffectiveness for the overall productivity, where the executives or the mid reps need to switch applications when they are on the field. So what SalesJump and Sanifos together brings a brand called as San Sales, which helps. So one application which supervise their attendance to their logout. So end to end. So their attendance along with the geotagging and their order booking and visit analysis based on the geofencing, and tracking based on the movements, or tracking based on the activities done by them. So all the logs will be present there. So it eliminates the false reporting and improve verification for the administrators as well as their managers. The key factor that the OTC solutions will bring to the order management and order tracking separately. So instead, we have integrated into one single system, as I said which brings all this field activity together into one system. So this helps the business people to effectively track the medical representatives or sales representative actively, while they can book orders, they can manage the operations very easily, smoothly, and effectively. So going into the challenges, what OTC has faced in the market, OTC companies as a business managers or the business holders, what they are facing. So the first challenge we are going to speak about was the overcoming retail quantity challenge with the retailer offtake. So there is an option which SFA has a functionality to identify and capture the retailer offtake. So what is the quantity available in the retailer point at the time of orders or at the time of visit. So the challenge is the med reps and the sales representative in the pharma OTC industries. So they struggle to manage multiple orders effectively. So where the miscommunication will happen with the distributor and retailer. So they will take existingly super stock available in the distributor point or the executive point. The executives will place the order. So the solution what we gonna provide was, so they can able to capture the orders which is available in the stock So they can capture stock along with the orders. So two simultaneously. So I can able to take the order for the particular chemist or particular shop or particular customer along with the retailer offtake option. I can able to capture the stock available on the particular location. So which product, what is the stock availability along with the inventory data like so what is the batch number, what is the manufacturing date, or what is the expiry date also I can able to capture.
So Saravanan, will this be a real-time data?
Yes. So it won't be 100% accurate when it comes to a super stockist or it comes to a data. So it will be a actual capturing of a shelf. So what is available on the customer place. So this will give you an insight to identify the demand, identify the sales trend on the particular location. So which will optimize the supply chain operations and the effective stock management to take a better decision for the decision makers and very especially for the distributors and the stockists, where they can decide whether to deliver or whether to supply the stock to the particular location. Moving into the second challenge, taking control of your price strategy. So the many OTC companies we have discussed and we have implemented, which what the struggle they are faced. So they have a customer-wise price. So they have a categories, they have a segments like A, B, C or silver, gold, platinum customers. So where they will have a different type of rate cards. So individual rate cards for the individual customer or individual margin for the individual customers. The solution what we have came up with. So we can able to provide individual person-wise, customer-wise pricing structures.
What about this state-wise and region-wise pricing?
Yes. So coming into that particular point, we have derived the rate cards into multiple categories and segments. So it can be a stockist-wise, it can be a distributor-wise, region-wise or customer-wise. You can able to draw a graph. So what kind of rate card with whom it has been mapped. So the real-time challenges is customer-wise pricing, and the practical challenges which done by the managers or done by the administrator was a region-wise or a specific customer-wise pricing. So what we have done is to create a pricing structure with the rate cards. This will maintain a consistency and transparency in the pricing strategies. So the solution, as I said you, that you can derive a stockist-wise or region-wise, customer-wise pricing, and not only a stockist-wise pricing or customer-wise pricing, where you can able to provide a margins. For example, a customer A will have a 20% margin, and in the same region or same beat or cluster, a customer B will have a 30% margin based on the demand. So you can able to set all these margins also from the MRP, or you can able to create our own personalized or customized rate card for the particular customer also. So unlikely a full-fledged DMS, so it provides flexibility in handling pricing structure. For example, so instead of taking an order in a different price and sharing to the distributor in a different price, so you can able to capture the executives or mid-rep from the field can capture the pricing with the order. So where there will be no consequences between, or it will create a very transparent, clear-cut understanding of the pricing, where they can able to provide the hot copies or digital copies of order confirmation directly, so which will not create any hassle or which will not create any dispute between the stakeholders and the distributors.
And also, in our earlier discussion, we were discussing about the photo capturing of the prescriptions or something. So, will that also be available in this version?
Thank you, Vichu, for bringing that up. So, getting into that, all the modules has been provided with the event capturing option. So, any event capturing can be provided with the title and also with the description. So the event capture can be used in two different challenges will be compromised. One is, so whenever they are doing a marketing activity like hangings or any digital vouchers or digital pamphlets or any kind of marketing activities or campings, anything. So whenever they are doing that kind of activities, they can able to do it. Along with that, inside the product wise, individual product wise also, they can able to capture. So this option is upcoming, the competitive analysis, we will go it in depth. So they can use in multiple locations or multiple fields where they can able to capture marketing, sales, promotions or merchandising. So all these options will come out with the photo capturing, the live picture capturing, along with the timestamp, along with the location also you can able to capture. It is all configurable based on your requirement. And taking you to the next challenge and solution. So the product showcasing with the power of visualized detailing. So currently, many companies, what we have seen, what we have understand from the market was for visualites, they are using a different tabs or a different visualizing tool. And for reporting, they will be using a different mobile or different tablets. So what SFA we provide, we have came out with an idea. So where you will have a product showcasing feature. So which will create additional option to carry one device. So any MedRep sales representative who are using a tab or mobile phones or any kind of device, so they can use one system. So the system will have this option. So where they can carry multiple brochures and leading to them to outdated product information or new material informations, any kind of informations they can carry in a digital format. And this makes it challenging to provide retailers with accurate and engaging product detailing. So it can be helpful. These are the challenges. When they are carrying a physical document, they cannot go for multiple documents at the same time. So whenever there was a question asked, whenever there was a information they need to provide, which is a different e-detailing or detailed visual aid, they need to search and they need to present. So the solution through this visual aids and detailing, MedRep's representative can initially display the product detailing digitally.
And do you also are planning to provide this on a brand wise or a customer wise? So in your platform, I've gone through that in OTC when it especially coming to placing of an order or promoting a product to a customer, you got this pre-call. Similarly, based upon the previous order or the brand matrix, will only that specific products be displayed to the customer to make it more effective for the customers to present or something like that?
Correct. What we have done here was we set the priorities. So for example, in OTC, so the more priority was given for that particular matrix. For example, customer A was mapped with a chemist, or customer B was mapped with in a supermarket, a hypermarket, or customer was a doctor. So when he owns a own clinic in the location, so you can able to digitally configure. So which need to be prompted, and based on the previous analytics of last 3 visit or 6 visit data or 6 presented data, the system will suggest them. So what has been detailed and what has been missed out in the priority list. So the data can be assigned in any format, like it is not just a presentation. You can able to upload as a PDF, you can able to upload as a video, it can be any kind of image, or it can be a MOV file. So it is completely, all the options are available. So you can also upload through a GIF file also. Few companies, they can able to upload the GIF also to make sure they will attract and they will capture the vision of a product. So they will explain the vision of the product. So these are the features which can be additionally given as a solution which is existingly available. And coming back to the solution, so the major solution this will provide was not to carry multiple applications or multiple devices for the visualites, and you can also reduce the printing cost and ensuring the immediate access to the prominential content. And MedReps and sales reps can use this digital promotion material instead of carrying a physical brochure, making it easier. And also the major important data was, so the major solution what we have observed from the market is all the existing detailing or visualites are completely online based. So the SFAs will provide both online and offline detailing. So this will help the MedReps and sales representative to present in offline. So they just need to have a tab with the charge, so they can go for it, they can present, and all this timelines, everything will be captured based on the current timelines. So they cannot manipulate the timelines if they are using in offline. They cannot manipulate the location, they cannot manipulate the what are the tabs they have. And we have also came out with a solution to give a timelines for the individual slide wise or individual presentation wise, how much time they have spent on the particular tabs. Getting into the next solution. So eliminate the incorrect claims and automatic expense calculation. So many companies, the expense was not automated. So they will be following a SFC, or they will be following a manual, or they will be following a different separate system to capture a HR related system or separate expense system to monitor and capture the expense part. So the challenge what they face often is, so they struggle to track their travel expense correctly, which led to display or delay in getting their money back, because expenses what the executives will claim and they will get back, managers will claim and get back. So using this money, they will go for their next visits. So the manual calculating distances and cost takes extra time and can be inaccurate sometimes, because the executive claims as 100 kilometers, the manager may reject or approve. No one knows what is exactly calculated. In few conditions, especially in OTCs, SFC will be some troublemaker for few locations. For example, especially in terms of this animal divisions, veterinary divisions, or going for this modern trade and general trades, where they will be visiting a different location to meet the procurement teams or purchasing teams or veterinary doctors. So those conditions, so it will be very difficult to go with the SFC. So what solution we have come out with? So through automatic distance calculation and systems, so the travel distance is automatically calculated and it will be provided as an additional supply. Yes, Mr. You have anything, Vichu? Okay, sorry. So for calculate from one customer place to another, so it will be automatically calculating the distance. So it has a more than 95% of accuracy in calculating the distance, and you can set the fare. What is the fare per kilometer? So and it can reducing errors and ensuring accurate travel cost tracking. So the solution this automatic distance will provide was, it has 95% of accuracy, and the disputes between the claim and the approved will be significantly removed, or I can also say it can be completely eradicated. And
so how does this works in offline when it comes to an automatic distance?
So we have this GPS based tracking and call based tracking. So every 15 minutes or every activity A to B, what is the shortest distance they traveled and the actual distance they travel. So there is an algorithm. So we are following Google algorithms. So we have tied up with Google for calculating the automatic distance calculation. So the algorithms will provide us the data. So using that data, so we can able to calculate the distance. So whatever the distance they have traveled, so it is completely. Only condition is, it is not internet, it is not the data. So the only condition is they have to be on the field. If they are not moving, the distance is not calculated. If they are not reporting, the distance is not calculated. So it is all based on the movement and the activities which they have done. So one conditions you can also set it as without activity also. It is completely a system configurable. And coming back to the solution on expense claims. So this can avoid incorrect travel expense and improve transparency and effectiveness for the pharma and OTC fields terms. So very special cases, so there will be transparency issues between the claim and between the applicable. So in few conditions where they will be traveling to a different location for a different condition, where the team cannot remember or admins cannot remember or HRs cannot remember. But when they have a track and proof of travel along with the distance automated, so you will have a clear-cut logs along with the timestamps where they visited, what time they have visited, and what is the reason for the visit which they have been updated. Even going back for a couple of months back to having a analysis on travel expense claims. So you will have a clear-cut idea when you move to this kind of manual calculation. And also for a few conditions, we have also provided with this manual along with speedometer capture. So the SFAs will provide you the speedometer based capture. So opening and closing speedometer along with the photo capture for the reference. So opening minus closing will give you the exact calculation of a total distance calculations. So the problematic solutions on distance is only three conditions. One is SFC will not cover the entire for OTC, and in manual will have a dispute between the managers what they approved and what they have claimed. And coming back to the automatic distance, so it can be a distance based on the GPS, or it can be a distance based on the travel based on the speedometer. So all these challenges can be overcome with the SFAs. And moving to the next solution. So optimize the fraud prevalence with real-time or order-wise tracking. So this is very usual. So many companies, they will feel, so there are 20 visits done by the executives or managers. So they strongly believe all the 20 has been visited. But sometimes due to some assumptions or mislead done by someone, they will believe they have visited 15, their 15 has been updated by them to make sure they will cover 20 as a target. So using this option in SFA, so you can able to track order wise. So the managers and the administrators always struggle to accurately visit retails. So and logging fake false visit. So without a proper tracking, it becomes difficult to ensure accountability and measure productive accurately. As I said you at the beginning, so if they are visiting 20, so to accurately visiting 20 was not an easy task. So to have a log or to have a track. So we cannot have a 24/7 person who will monitor all the executives. So getting into the solution through real-time and order-wise tracking, which give a verified visit and records, preventing fraudulent activities and improving productivity. So this can be achieved by two options. One is geofencing and geotagging, and the second option is the tagging based reporting. So when we go for tagging based reporting, so whenever they visit a customer, or whenever they visit a chemist, whenever they visit a doctor, it will actually capture the real-time location. And whenever they are traveling or whenever they are idle, so every 15 minutes to 20 minutes, it will capture the location, and this will happen in offline. So they don't need an internet, they don't need a SIM card, they don't need to connect with any Wi-Fi material to have this placed.
But the GPS has to be on, right?
So if the GPS is not on, the application they cannot access. So it will capture the GPS. So if they want to report or if they want to log in without the GPS enabled, they cannot do that. So the application will not allow them to report or allow them to log in for the attendance or anything. So the system will not allow them. So if they are terminating by nature, by forcing a GPS turn off, so we can able to find out if there was 2 hours idle, there is no data, it is force stopped by the executives. And the order-wise tracking and mapping, so will ensure the transparency and accountability in the sales visit. So it is not always about the productivity. So the challenge can be overcome. So whenever they are visiting also, they can able to update the reason for the visit. So it will have a clear track. And preventing unauthorized distribution and scheme and claims. So this is another troublemaking solution which many OTC companies and pharma companies, even FMCG companies face in the real time. So the first challenge is companies often lose the track of free samples and promotional gift given to the customers. So the customers, the company will provide to the stockist or directly to the customer, but it will not be reaching the exact destination. So there will be no proper record or no proper tracking. So it will become difficult to monitor who received the item and whether they used by the effectively. So in the field, so the company has provided, the organization or business managers or distributors has provided sampling or any kind of schemes. For example, FOC or any kind of options like buy one get one, buy 10 get one, or product versus product, buy A product get B product. Whether is it reaching the customer or targeted audience. So through the automated scheme management system, So every FOCs or every samples or every promotional gift will be accounted. So this ensuring the transparency and preventing unauthorized distribution. So as an organization, it will be provided to the stockist or distributor, but it will not be reaching the customer. So choosing a OTC SFA, this will be informed while taking the orders or while doing a invoicing. It will be automated. So they will be forced to provide whatever the schemes or whatever the samples or whatever the promotional gift which is provided to the particular customers. So the misconceptions. So the organization might have think the gift and claims or FOCs has reached the particular customer, but to make sure this will be accountable in promotional activities across the pharma and OTC industries, by using this scheme option, this will be reaching. Coming to a gift option. So this is a special condition, gift and claims. FOC and discounts is okay, but gift and claims. For example, the company will set a target or a company will give a promotion, for example, by having an invoice of 20,000 rupees in a month or in a particular time period, fortnight or weekly. So if they are achieved, this can be claimed. So this can be claimed to the distributor or to the company by the executive for the particular customer. So the executive is a responsible person for providing the claim. If the claim was not provided, yes.
Which is basically like even the pharmacies can make a claim if they have reached the concerned target that has been fixed by the pharmaceutical company. If I'm not wrong, right?
Exactly, you're right. So whenever the pharmacy-based target has been set, this is for the sales, not for the order. So based on the invoicing done, so you can able to claim the gift for the particular pharmacist or particular customer also you can able to provide. So this will help to build a rapport between the chemist or between the customer in the field, and also it will increase the brand credibility. Whatever they have promised, it has been provided by the company. So the credibility of the branding will also increase, and also the contact between the managers and the executives, along with it can be between a stockist, it can be between the pharmacist or customer. So that credibility will be increased for sure if we are being accountable for the provided gift and claims.